I have to read you the actual name of a court case because I just love this. Commonwealth of Massachusetts versus Oz. Yes, it's that Oz. Not Wicked, not Defying Gravity, and not If I Only Had a Brain. Well, maybe that one. Yeah, I'm talking about Mehmet Oz, the man who sold America green coffee bean extract on daytime television and is now currently running the Centers for Medicare and Medicaid Services, and he is the named defendant in a lawsuit brought by 25 states and the District of Columbia. And I would love to spend this whole segment on making this one big running Wizard of Oz thing, but I'm not going to because this lawsuit actually matters. It matters because starting in January, Medicaid expansion recipients, adults that are 19 to 64 living at or below 130% of the poverty line. Starting in January, you have to document 80 hours a month of work, volunteering, or job training just to keep your health benefits. That is what came out of last year's tax and budget bill, the same bill that carried over $1 trillion in tax cuts for the wealthiest 1% of our country, people that will never have to prove how many hours they work or have to worry about their health care coverage. Now, Congress did write in some exemptions. The law says that people who are medically frail or otherwise have special medical needs are excluded. And they specifically list anyone with a serious or complex medical condition. Sounds pretty clear. And Congress said if you are seriously sick, this doesn't apply to you. So it was up to CMS to write the rule that interpreted that language. And here is what that rule says. A terminal diagnosis is not enough. Cancer, HIV, Parkinson's. A doctor telling you that you have a disease that will end your life. And under that rule, none of those things by themselves get you the exemption Congress wrote. You also must document to your state government satisfaction that your condition significantly impairs your ability to work 80 hours a month. So the position of the United States government is that a terminally ill American has to prove that they're sick enough. Fortunately, 25 states and DC sued, and Thursday a federal judge named Richard Stearns up in Massachusetts denied their request to freeze that rule while the case proceeds. Now, I've got to be accurate about that because I've seen out in the coverage outrage on either side. This judge did not rule that this is legal. He denied the injunction on the concept of irreparable harm, specifically that the state's cost of complying are reimbursable, because the federal government has agreed to cover 90% of them. So he wrote that the denial is not a reflection or an anticipation of its ultimate views on the merits, and he denied this without prejudice, so the states can bring this back. So the harm that the court was weighing at this stage was just the accounting part. The merits are still coming, and those are scheduled to be heard before January comes. But right now, that rule is the law of the land, and states have to send notices out by September 1st. And in the comments, I genuinely want to hear from the people who work in healthcare. Doctor, nurse, social worker, a caseworker. What does this paperwork actually look like on your end? How much more red tape is this going to cause? Because medical groups are already warning that this caseload is going to land on clinical staff who are already underwater as it is. And I want to hear from you guys the reality. So please, healthcare workers, drop me a line in the comments. And do me a favor, if you're in the comments and you see a healthcare worker chiming in, hit that thumbs up because I want to see those rise to the top. And look, we've run this experiment before. Arkansas, they did work requirements in 2018 during Trump's first term. A judge stopped it within a year. And in that time, roughly 18,000 adults in Arkansas lost their coverage. And the studies that came after found that it didn't increase employment at all. All it did was remove people from health benefits. And frankly, I think that's their entire intent. Arkansas saw 18,000 people that they didn't have to pay anymore because they weren't going to work anyway. They couldn't. So Arkansas was like, hey, there's our excuse, 18,000 people off our books. The Urban Institute projects that between 3 and 7 million Americans could lose Medicaid coverage under this new national rule. Many of them, and this is what matters, it's not because they refuse to work, but because they cannot successfully complete the paperwork proving that they are looking for work. In Arkansas, for the first several months, you could only report your hours online. Advocates found that the site was confusing, especially for older people that didn't have much computer experience. And look, somebody really did sit in a room and read the words serious or complex medical condition, and their job that day was to figure out how to make those words meaningless. I have a hunch at what industry they're in. And look, these people did it. They were successful. They found a space between having a terminal illness and being sick enough to count. And then they built a tower of paperwork around it. Being seriously ill is not waste and fraud. 3 to 7 million people because of paperwork in January. And the only reason any of it is still in front of a judge is because 25 states and the District of Columbia decided to fight. And that's why I'm asking you to subscribe, because this one's got a January deadline attached to it. And I am going to keep following it until it gets fixed. And if you really want to help us out, consider becoming a member, because that is the best way to make sure that we can keep putting out more content like this.